right, good afternoon. Thank you very much for joining us. I know there's a few people the Zoom is continuing to grow, and so we'll let some of the more participants join in, but I'd like to go ahead and get started to kind of keep us on time and talk about Healthy State and an initiative that we launched back in 2020. And then also share some of the thoughts from our expert panel that have joined us here today. I'm Leo Seoane. I'm a pulmonary critical care doctor by trade and also serve as the Chief Academic Officer for Ochsner Health and have the privilege of also being one of the leaders for the Healthy State initiative for Ochsner Health. You know, in 2020, as we were looking at the decade to come and trying to make a decision of, as an anchor institution in our community, how can we be more impactful? We presented to the Oxyher board back then this idea of improving the health rankings of Louisiana from where we've traditionally been 49th to 50th to 40 by 2030. We knew it was bold. We knew we couldn't do it alone. We knew it was going to take a collective effort. And we knew that we could not have a healthy state until we have an equitable state when it comes to health equity. And so with that, we launched, and as you are aware, at the beginning of 2020 was the pandemic. It's coming up. We just passed our 2-year anniversary of March 7th, which was our first COVID patient admitted to an Oxford hospital back in 2020. But this panel, the panelists that you will meet today have been working diligently, not only through the pandemic, but also working on the Healthy State initiative. So I want to extend my gratitude to the Urban League, who's partnered with us on this Healthy State initiative, and the Louisiana Legislative Black Caucus. We share the values that they share, and that is to, again, improve the health of all citizens of Louisiana, especially our African-American community. I'll start by introducing the Healthy State Plan, and then our participants will talk about their roles in improving the health and well-being in their communities through the lens of health equity. So next slide, please. So when we looked at the state of the state, like I said, you can go back 20 years and we really are about 49th to 50th. Now there's some things we do well. We rank 26 among the 50 states for public health funding. That is largely thanks to Governor Edwards and the Medicaid expansion. We do really well with HPV vaccinations, which prevents cervical cancer, which is a devastating disease that inflicts young women in the prime of their life. And HPV vaccination can almost make cervical cancer go away. 99% prevent it. And we do okay with mental health providers and when we rank ourselves with other states. And we've had a significant impact on teen births since 2008. But there are many, many more challenges. And when we look at many of the other key measures of wellness and health, we're usually between the 40th and 50th. Those include high rates of poverty, high rates of premature death, high rates of cigarette smoking, and frequent mental distress. Next slide. You have to have a metric. We have to measure ourselves somewhere, that it needs to be a target. And so American Health Rankings is funded by the United Health Foundation. It's been around the longest, and it has a framework that we buy into. Because it doesn't just focus on healthcare delivery, it focuses on many of the upstream impactors that impact health, like poverty, like high school graduation rates, like income. And so when we can imagine, if we just take a few seconds to imagine what a healthy state could look like for Louisiana, people would live longer, 3 to 4 years longer. We'd have 27,000 on average higher incomes for our citizens. We'd have 4% lower unemployment. And we'd have 11% fewer people living in poverty. And this is achievable, but it does take our collective efforts. And we deserve this. We as citizens of Louisiana deserve health and wellness. We don't deserve to be ranked 50th. Next slide. So, as I said, the panelists have been working diligently over the last 2 years and created a roadmap for this healthy state that really has communities at the center. We created an internal advisory board to Oxyher, and we created an external advisory board with key stakeholders across the state. The Urban League is represented in that external advisory board, and I'm very, very proud to say that we had our first kickoff in-person event yesterday here at Ochsner Health, where we had representatives from key business leaders, representatives from the state, representatives from every university, and representatives from key community leaders at that first kickoff meeting. That work will continue through committees, and we will continue to re-engage with our communities going forward. Next slide. And so our healthy state framework really is built upon looking at everything through a lens of health equity. Those include social equities, institutional equities, living conditions, healthy behaviors, and health outcomes. And our panelists today will touch on each one of these areas as they answer through their questions. I also want to point out that we do want to take your questions. So I'm going to try to be cognizant of time to leave about 10 minutes at the end. So if you do have questions or you think of questions as we go through the discussion, please put them in the chat and I'll read them and we'll get to them at the end. Next slide. Again, we understand that this needs to be a community-led, informed design. The Urban League is one of our partners and one of our key areas where we can listen to our community and leverage their expertise and their methodology for connecting to the community. But we're also partnering with the Louisiana Department of Health. We participate in community needs assessments throughout the state as Oxyher has a statewide footprint, and we've incorporated many of the community needs assessments throughout the state into the plan. But we also are planning more community leader conversations, more focus groups, and we hope to be coming to your community soon to listen. Next slide. So now I want to move on to the panelists and really kind of key in on some questions that hopefully will open a larger conversation. So although I've selected key panelists to answer key questions, I do want to allow the panelists, all the panelists, to opine on the questions. And again, we'll get to your questions at the end. So with us today, my esteemed panel includes Kevin Green. He's the Vice President of Community Health Centers for Ochsner Health. Oxyher has committed $100 million over the next 10 years to improve the health of Louisiana, and the community clinics across the state are one of the key initiatives to be on the forefront of healthcare access to our communities, and Kevin will be able to speak to that. Deborah Grimes is our System Vice President and Chief Diversity Officer for Ochsner Health. You can't talk the talk unless you walk the walk. And Deborah Grimes is here to make sure that we walk the walk. She's done an incredible job. She joined just before the pandemic. And so she'll kind of give you some of her insight and some of the great work that she's done. Dr. Yvens Laborde probably needs no introduction. Medical Director of Global Health and Education, Assistant Professor of Medicine. Dr. Laborde has really led our community efforts around COVID, not just COVID education about the disease, but he's also led COVID vaccine trials and then COVID vaccination efforts, and really has been on the forefront of all of our community COVID vaccination efforts. Dr. Price-Haywood is the medical director of the Ochsner Xavier Institute of Health, Equity, and Research. She's associate professor at the Ochsner University of Queensland Medical School, and also is one of the key leaders in our Healthy State initiative. And last but not least is Victoria Smith, Dr. Victoria Smith. She's the associate medical director for the St. Charles Parish Hospital and Primary Care Kenner Region. She also leads ambulatory quality for the Ochsner Health and serves on the Ochsner Health board. And so with that, I will get started. And the first question is to Kevin Green, and it says, Kevin, can you tell us a little bit about Ochsner's community health centers? What do they have to do with Healthy State, and how our audience might be able to benefit from them?
Okay, sure, Dr. Swaney. Thanks for the question. Thanks for actually tossing me the first one and having an opportunity to share our community health centers and what I believe they mean to us as a city, as a state, and hopefully as a region. The goal of our community health centers is very simple. It's to create more access. I mean, there are those that are working in the community. There's LPCA and federally qualified health centers. There are other health systems, but the facts show that we just do not have enough access in Louisiana when it comes to certain services. So our goal is to create more access, and we want to do it in a way that uplifts our communities by providing more medically based services, physical as well as mental. But we also need to provide more social support awareness. So there are many communities that have services available, yet the awareness or ways in which those services can be facilitated to those patients in those areas, the resources just aren't there. So within our health centers, we not only bring clinical from a physical and mental perspective, but also from a social services support. And again, we know that many of you are in these communities and have done some amazing work, but we also know that there's much more work to do, and we're here to kind of join in those efforts. What I will also add is that we initially pledged to open 15 sites within a few years, and we are really on track to make that a reality. We have, like many others, we've experienced some things, so a few might be pushed into 2024, but when I say a few, I mean literally one or two. So we're really on track to bring these vital services across the state, and those will be locations such as Monroe, Baton Rouge, New Orleans, Shreveport, Lafayette, Lake Charles, North Shore, so the Bogalusa area. So most are urban, yet we are starting to branch out into rural areas. And I'll tell you, in many conversations, there's always an additionally identified need because we understand that there's just not enough resources. So even though we have these 15 coming, we know that we have to partner with everyone else to kind of make this a reality for ourselves. The first site opened in 2020, and Drew Brees gave a tremendous donation, offered $5 million that's truly spread across the state. That you'll see that we have 3 sites that will be named after him, but we're truly using that in every site, and we're bringing all sorts of technology to bear here, whether it's digital medicine, whether it's telemedicine, of course, the advances clinically within Ochsner. So every service available with our normal Ochsner primary care or other complex clinics are going to be available within these sites. So the same standard of care is what we would expect, of course. Now, I would like to note that in Ochsner's pledge of 100 million, roughly 30 to 45 million are going to just open in these sites. So we're definitely making it a priority and ensuring that this is happening. So New Orleans is open, Baton Rouge opened in April of 2021, St. Vincent opened, which is in Shreveport, that opened in July of 2021. But then 2 more just recently opened, one in January, one in February, and they are in Lafayette and Monroe, respectively. We'll see a few more open this year across the New Orleans area and up in Shreveport, and then we'll start to see them expand across the state. So when we say we're here to create more access, we absolutely are. At year-end 2021, I believe we saw there were 12,800 patients seen by year-end 2021. We're expecting that when all sites open, we'll be well over about 150 to nearly 200,000 visits that we're able to manage. So that'll be exceptional in my opinion. What I also like to add is I do think that we'll see an expansion to rural areas in the future, but our initial goal is to stay focused on the urban areas because that's where the population density is, and I think that's where we've identified our ability to have the greatest shared impact with everyone else. Now, to the second part of your question as to how we are incorporated within Healthy State, we are more, and from my perspective, we're more of an implementation arm, if you will, of many of the Healthy State initiatives that are going to happen with partnerships. So that's access, that's managing chronic conditions, that's also ensuring that we have preventive care and screening available for these patients. And that's truly where we kind of are the rubber that meets the road. I know we have many partnerships with research, we have many partnerships with social services, but we would love to be with many others as well as within Ochsner, that implementation component. And then lastly, you asked how our audience might be able to benefit from the resources and the sites that we have. And I'll say there are several ways that come to mind. One, become a patient. Come and use the services that we have. Not only you, your family, we have many services for all ages. So please come and utilize our services, but also feel free to volunteer. But don't be afraid to partner with us. And when I say partner, I mean socially, I mean in caring for patients together, but I also mean in a business aspect. So many of our challenges are socioeconomic. We as Oxyher are willing to share our resources and share your expertise in a way that benefits these communities. So when you think about, as we think through how community health centers can be a part of our more broad collaborative statewide initiative in raising our health rankings, I'd like to ensure that we all consider this through a multifaceted lens, and that there is clinical care, there are social opportunities, but there's also business and partnering opportunities within these communities.
Yeah, Kevin, incredible work you're doing with the community clinics. Can you extrapolate a little bit more about the services that someone could receive at your clinics and how those services may differ from what someone may receive at a traditional Ochsner clinic?
Sure. Many Ochsner clinics are not, I'll say, multidisciplinary in the aspect in which I'll explain. This is kind of a box concept, as in the services that are needed to help manage chronic conditions. Many of them you can find in kind of a one-stop shop. So you won't have to, those that are within the community, whether we're partnering or clinically caring for them, they can come to this one site and have much of their needs addressed, right? So we have primary care, we have pediatrics, women's services, and LCSW. We understand that depression and anxiety are very prevalent within these communities and within our communities, and we have resources to help address that. We have diabetes management and education. We even have smoking cessation, which until very recently, if not still so, was the #1 greatest negative contributor to our health outcomes. So we have a very prolific smoking cessation program, not only within health centers, but within other Ochsner sites as well. And what you also find is that in addition to historical in-person services, we have a very high percentage of patients that are taking advantage of our telemedicine services. I think last year we ended the year with roughly 23% of our patients using digital or telemedicine services, because we understand that it's difficult to choose between whether or not you're going to leave work and bring your child to a well visit, or being able to leave work to address something that could be done telemedically. So we ensure that that's available. So not only are we doing the in-person traditional approaches to caring, we're very multidisciplinary in the services that are available. We're also bringing all of our technology forward.
That's great, Kevin. Thank you. The next question is for Dr. Price-Haywood. Dr. Price-Haywood, you helped form and now are the medical director for the Ochsner Xavier Institute of Health Equity and Research that I so lovingly call Oxyher. Can you tell us, how did Oxyher come about, and what is its vision and mission, and why is it important to the Urban League audience to know about Oxyher?
Sure. Well, some of them may have already heard me speak this morning. So if you did hear me talk about this morning, some of it's going to be repetitive, but I think that's good. Maybe I'll just give you a little different flavor and some more info that's different than what I said this morning. But we first announced this collaboration for the Ochsner Xavier Institute for Health Equity and Research in November 2020. That was around the same time we made the announcements about the community health centers. We officially did a kickoff of our activities in January 2021. So we've been working for the past 15 months around creating a vision and executing on that vision and mission. And so in terms of the partnership with Xavier, it totally made sense for us because we've been working with them already for a number of years in a variety of different areas. And being that it's a third ranking HBCU in the nation, highest rate of matriculation of African Americans to medical school, and fourth ranking nationally, and moving African American students out of poverty, they as an institution are uniquely positioned to be our ideal partner to help us co-lead these efforts. And so it just made sense to form that partnership. And so moving forward, we had to set up a vision, which was to improve the overall health of our communities. And this aligns with the Healthy State Initiative, reducing inequities and developing innovative healthcare delivery models and modeling equitable and respectful care. So the framework that we use understands that each institution brings together resources and existing network that we're leveraging for this work. The other important point is that the Institute is designed to work with existing infrastructures to help people do their job through the vision or the lens of health equity, as opposed to people thinking we're coming up with something new. It's just looking at what you do differently. The founding, I call them guiding principles or pillars for the Institute, there are 5, the first of which is outcomes research. For outcomes research, I'm a researcher, so of course I thought it was important, but I think with COVID-19 pandemic and all that happened that showed us the alignment of clinical practice with public health and research, it makes sense for our founding pillar to do just that and deal with outcomes research. And so we are looking to advance the knowledge to improve clinical practice, health, and well-being in our community. A lot of the work that our researchers have been doing are perfectly aligned with addressing those drivers of the poor health in the state, as you outlined in a previous slide. And so some key areas include obesity, depression, anxiety, chronic pain management, chronic opioid use, chronic disease management, with a special focus on digital health technologies, as Kevin just mentioned in the community health centers. And of course, we've been doing a lot of work in COVID-19, participating in the vaccine trials and things of that nature. The second pillar is population health. And population health is a public health term. And really what it's referencing is developing systems that drive better health outcomes and experiences at a lower cost to the population. And the key to be able to do this is to have a data-driven approach to how we design models, but also use that data to gain insights to where we may need to develop new innovations. And so we have had a very focused strategy around helping organizations, our colleagues in the field, to standardize the areas of data that we collect, not just with race and ethnicity, but also thinking about preferred language as it relates to our immigrant population, non-English speaking people, sexual orientation and gender identity, another marginalized population, as well as where you live, rural versus urban. That's incredibly important. The piece of, as it relates to digital medicine, I just want to highlight very briefly is the work that we do with the digital medicine team around looking specifically at the Medicaid population and demonstrating the impact of participating in that type of chronic disease management. And the goal being not only to help improve the health of the state, but also to inform health policy as it relates to improving access to care under those different health plans. Our third pillar is health careers and equity education, where we're focusing on developing pipelines for a diverse healthcare workforce, integrating equity education into our professional training programs, and training our healthcare workforce to lead and innovate in health equity. One of the things that we're super proud of in working with Xavier is developing new science degree programs, one in a Master's of Science in Health Informatics and another in Genetics, all of which are incredibly important, and I think, again, has been proven to be important fields as it relates to the work with the COVID-19 and the pandemic. Those informaticists were the ones who were predicting when we were going to have another surge. We also recognize the importance of early exposure to career opportunities and have developed paid internships where we have Xavier students coming into the Ochsner Health network and being exposed to work in a variety of areas in the clinics, as well as our pop health management programs, telehealth, and mental behavior health, and a variety of other fields. Finally, we have a community health worker apprenticeship in collaboration with Delgado and Kingsley House, where part of the training in this program also gets you a certification as a clinical medical assistant. We have a career track pathway that allows you, or supports, I should say, your training to go up into an LPN or RN track. The implications of that being is the upward mobility within the organization, as well as the economic impact it has on the household and the neighborhood. Our fourth pillar is community engagement, and Dr. Laborde leads that. So I'm not going to say a whole lot more because I can't speak better than he does. But the most important point of that work is that we recognize that equity cannot be achieved overnight or by working alone, and that we are working very diligently with Dr. Laborde as a leader, creating these valuable relationships with trusted partners so that we can make a true difference and so that we can design and scale up innovations that the community has had input primarily in designing, so that we have sustainable and feasible solutions that we generate. Dr. Laborde has done a lot of work in the equitable vaccine world, so I'm not going to say anything about that, but it is one of our pride and joy. Finally, the fifth pillar is health advocacy and policy, where we are focusing on advocating for policies to improve community health within 5 areas: tobacco, maternal health, education, digital access, and job opportunities. Most of our efforts have focused on maternal health. As you may be aware, the state of Louisiana is a place where they said it's the worst place to have a baby. And so clearly we have to protect the upcoming generations and do work in that area. And so that has been our focus on the regional, state, as well as federal level.
Thank you, Dr. Price-Haywood. Appreciate that. Next question is for Dr. Smith. Dr. Smith, I want you to put your primary care hat now, because she carries many roles, and talk about what the work that you've done in addressing health disparities in the community as a primary care doctor, and how that work is important for all the patients that you serve.
Well, thank you. And so excited to be part of this. I think that, dealing with our COVID pandemic really brought to the fore things that we already knew were there in terms of racial, ethnic disparities. And so during that pandemic, it was during the pandemic that we're still in, it became so clear the impact of race and ethnicity and also social determinants of health on what was happening for our patients. As we know, those who were adversely impacted, especially at the beginning, were those people who were working in jobs where they could not remote work. They were essential employees, but they were not provided, say, with personal protective equipment. They might be living in multi-generational homes where even if someone was exposed to COVID, they could not isolate within the home. I happen to have a large African-American and Latino population and could really see, how this was really impacting my patients and, also their families. I'll never forget seeing a patient, who had lost 9 family members due to COVID. So, as a result of, I think seeing what we saw during the pandemic, I think that really led to a lot of work with, the formation of Oxyher, but also within Ochsner and looking at quality, being able to look at things through a health equity lens. Like Dr. Price-Haywood talked about, I'm not going to steal Dr. Laborde's thunder about the equitable vaccine work. But, that was a great initiative saying, here we have populations that are being disproportionately impacted by COVID, but yet may have not be getting the same access to COVID vaccines due to lack of access or maybe misinformation. So, I think a lot of our work around our equitable vaccine distribution was, very impactful. Right now, I feel like we have been also through our data integrity work that's being spearheaded through Oxyher, we've been able to now look at our outcomes through the lenses of health equity. And so to be able to say, okay, let's look at how are we caring for those with diabetes, and are we controlling that? What percentage of our patients are we controlling that for? But then let's now take a different slice. Let's look and see, okay, are we controlling it better for our white patients versus our Black patients versus our Latino patients? So then we can actually, with that data, then be able to drive different outcomes. So that's just some of the things that we're working on, in primary care to be able to erase disparities based upon socioeconomic issues as well as race and ethnicity.
Thank you, Dr. Smith. My next question is for Deborah Grimes. And Deborah, as you know, many of the drivers of our poor health and well-being in the state of Louisiana really aren't about care delivery, as we kind of pointed out at the beginning of the talk. Can you tell us some of the things that Oxyher is doing on workforce development, education priorities, and other things to kind of help us train the next generation of healthcare providers, but also help us around raising people out of poverty, giving people jobs that are living wages?
Yeah, that's a great question. I think you make a valid point. When we started thinking about the healthy state vision, part of it was understanding the why behind why we need to have this vision. And we did a lot of data review, and we had a lot of conversations, did a lot of listening, and it became clear that economic hardship is really one of the key drivers to having poor outcomes. And if you want to address economic hardships, you got to start thinking about two things, right? Workforce development and education. And you have to do those things at the same time, simultaneously. And so we started really thinking about, okay, what current state, what are we doing? And how can we do more? And when you think about education, we have K-12 outreach programs because it's clear you have to reach people early in that education process. And so we have a lot of outreach programs, kindergarten through 12th grade. We also have our summer STEM program. We have a lot of academic partnerships, as you know, with Queensland, Xavier, Loyola, Delgado, and also Chamberlain School nursing programs. So that was important to keep the momentum with all of those partnerships. And then, we had to think about ourselves as an employer, looking to make sure that we had excellent employee tuition assistance programs, which we do. And then as a part of the Healthy State Commitment, we have about $100 million committed, and part of that commitment is going to go to pay for scholarships for medical schools, to pay for scholarships for nursing school and for allied health professionals as well. And then, we think about our Ochsner Scholars Program. We've committed $30 million to help with tuition reimbursement if you're going to go to medical school and if you're going to go to nursing school. And then we said, but that's not enough. We've got to seek out other partnerships. And I'm really excited about the work that we're going to do with Loyola, looking at nursing, allied health programs. The simulation center is fantastic. Thinking about from the perspective of also careers, right? So part of it is you may come into the healthcare system in a very entry-level position, and we're happy that you're coming in, but at the same time, exposing employees that, if you're a great performer, if you, there are so many other things that you can do in healthcare, and really starting that pipeline programs is really important. We have, if If you come in as a PCT, we have the PCT to MA program. We have the MA to LPN program. We have the LPN to RN program. And there are going to be many more of those pipelines because that's going to address that health disparity, the economic hardships that we just talked about. And then I think also, you know, we've got to think in terms of how do we deliver culturally competent care. And, you know, that's part of my role is to make sure that we have diverse and inclusive place for all of our employees and practitioners to thrive in. And we have a 5-year strategy. We have pillars identified. We have 10 employee resource groups to help provide that inclusive space. And we're really excited about, partnering with HBCUs and partnering with the community because we want to not just think in terms of what we know, but also in terms of listening and how can we do better.
Yeah, thank you, Deborah. I think Dr. Smith also wanted to comment.
And I just wanted to add sort of a real life example in the clinic where I practice of some of these workforce development programs. Our MA Now program, which has taken folks who are maybe underserved or underemployed in the community. We have hired a couple of folks who have trained there and they're now MAs at Ochsner. One of the MA to LPN apprenticeship program, there was an MA in my office who was a single mom with young children. It would be almost impossible for her to stop working to go back to school, but she is a mover and a shaker, and she was so excited to be part of the MA to LPN program, and she is getting ready to take her tests. So she'll be an LPN. We also have a community health worker apprenticeship program, and we now have 2 community health worker apprentices in my clinic. And so they're going to be helping to gather the social determinants of health data from our patients, but also to connect them with resources. And they are learning on the job and they're providing care and they're able to earn while they learn. So it's just these workforce development programs have just been so powerful. And I just wanted to give just some real life examples just in one clinic.
Thank you, Dr. Smith. This next question is for Dr. Laborde. So finally, Dr. Laborde gets the thunder. Can you provide some additional commentary around our focus on education as it relates to the healthy state efforts, both within Oxyher and with our community partners? Get you off mute, Dr. Laborde. You slip back into mute.
All right. Is that good now? Can you hear me?
Yes, we can hear you now.
Thanks, Dr. Swaney. Well, it wouldn't be Zoom if I wasn't on mute. But just really pleased to be here on this panel, and with that powerful testimony from Dr. Smith kind of really is emblematic of the whole healthy state, and from my view, the critical role that education is plays in our ability to achieve our stated goals. Because many of you know, I mean, and it's well established, obviously socioeconomic status of which education, and from those examples that Dr. Smith just gave, it's just a key driver of everything. And critically importantly, it's strongly linked to health, and specifically to the determinants of health in so many ways, in terms of health behaviors and also of preventive services. And one simple example, if you look at education level associated with smoking behavior, the more educated an individual is, the less likely that they are to actually smoke and to use preventive services. And beyond that, obviously the data shows that there's a significant direct correlation between higher levels of education and improved health outcomes, both at the individual, as Dr. Eboni Price stated earlier, at the population level as well. And it's not hard to see that states, from a global perspective, whether it's states or counties or countries, and if you look at the data, you'll see that those countries with higher income or states with higher income will obviously have correlated with low unemployment rates. And so it's obvious that enhanced access, to education can not only lead to better health, but also to better jobs and better health outcomes. And so again, it kind of reiterates the importance of focusing as, Dr. Eboni Price-Haywood recently did, and then, Deb also, in terms of the importance of education throughout the continuum, to make sure that we have programs that are effective and that address disparities in education and actually improves access to education for underserved and underrepresented communities. And our experience obviously has been that when it comes to education access and opportunities, for me, whether it's been global or local, no matter where, what I've realized is that the issue is not necessarily ever an issue of capability. It tends to be more about access, exposure, and opportunity. And one of the things that we talk about oftentimes is it's difficult to become what you cannot see. And so Dr. Price-Haywood, Dr. Smith, pretty much everybody on the panel, we made it a point, both personally and professionally, during our careers, to make sure that we serve as excellent role models, that we mentor, that we guide, and we're always present to teach multiple generations, whether it be at Ochsner and multiple levels of providers here and beyond, and also at every level within the community. That's why the engagement from a community level is critically important. And to ensure that we're effective in doing that, one of the priorities that we make is that we work very closely with our community affairs team. I think, Tanya Moore, with whom that we work very closely, along with Alice and Shireen, that whole team, who are very dedicated, and we're always ready to provide our expertise, mentorship, and guidance through a number of K through 12 local outreach programs that we're willing to essentially practice what we preach. As Dr. Eboni Price-Haywood, being faculty at the University of Queensland Medical School, that we actually have here as well, always make it a point, whether it's for the students or with the residents, to ensure that health equity through the lens of both the community and global perspective is always at the forefront of our discussions, and to incorporate the concepts of social determinants as we educate them at that level as well, and we continue to do so. And one relevant part to this is, again, Dr. Swaney, in his role, we started, many people may not know this, but a global health education program, at Oxford many years ago, with the concept, which is very evident now, that global health is actually local health, to ensure that our trainees get the opportunity to develop what's actually been critically important now, this idea of having more of a global view of health, not just in terms of geography, but that it's also reflective of the diverse populations and the fact that our world is truly interconnected. And understanding that really allows us to be more effective in being culturally competent in communicating and serving the patients that we actually serve. And so in order to do that, the program in itself, we've been involved not only here locally, but people may not realize we have outreach activities in Latin America, the Caribbean, India, Africa, but we always do it through a lens of equity in terms of academics and social justice. With the idea is that in doing that, both in terms of our learnings and what they bring back here, is that they develop more of a universal understanding of the drivers of health inequity and poor health outcomes. And with that understanding really allows us to better devise more effective local solutions with that global perspective. And in a very real and material way, as it relates to healthy state, we always said that you can't have a healthy state unless you have an equitably vaccinated state. It was really paramount in our successful pandemic response at Oxford here, because in part, I think we were informed by our previous experience and expertise and understanding very early on how critically important this concept of global health is, local health is, and how directly applicable it is. And it's one that we've been advocating not just with the school, but within Ochsner and Ochsner Health for a long time. And it's really relevant because the fact that at this point in time, with a lot of the work that Dr. Swane's done and reaching the reach of our academic capability at this point in time, many may not realize that, but at this point, Ochsner, we represent the state's largest academic health system at this point in time with hospitals and clinics, across the state and in the Gulf, and it allows us an opportunity to have more of a direct influence. So again, it allows us to serve as a catalyst, not just here, but statewide to better coordinate and align a lot of the research work that Dr. Eboni Price-Haywood is involved in academics, clinical, and then the community capabilities in terms of engagement that we're all with Kevin and others have worked about, so we can create what I like to think about as a unified, academic health clinic ecosystem flywheel with a shared public agenda that's going to allow us to improve the health of the state. And along that line of thought is that there's a particular quote that I like a lot from Malcolm X, and which is really appropriate because it says that, if I remember correctly, that education is the passport to the future, and as such, for tomorrow belongs to those who prepare for it today. And I think if we are hoping to have a healthy state in 2030, it's going to be critically important that we provide our communities and our citizens the passport to that future. And so given the current national and global climate, it really kind of underscores the importance of these relationships that we're developing with historically Black universities, both here, obviously Xavier, we've interacted with Dillard, with Southern as well, for advancing the work, of social justice and ending racial inequity through the attainment, I guess, of higher education, which is paramount to all that we're doing. So again, really couldn't say it enough. I guess in reference to that, given the fact that it's a continuum with Kevin and the work that we've actually done locally to ensure that the children have access to better education, and also our partnership with a number of organizations like the Son of a Saint, and then really supporting a lot of these community outreach activities to ensure that students get exposed to these career pathways, to STEM research and a lot of the work that we're doing. And also work diligently with state partners to remove some of those barriers, because obviously there are financial barriers that can prevent individuals from getting access to these. So working together collectively to get that done. So really excited about this partnership, to be part of this panel, to work with the Urban League. And I'll finish with this one thought. It's this idea that from this discussion today, education for me is essentially, although Dr. Smith is a family physician doctor, you talk about from womb to tomb, I think education should be, in essence, from womb to tomb. And it is that passport that's going to allow us to build a better future and a healthier Louisiana for us all going forward.
Thank you, Dr. Laborde. This next question, and this will probably be our last question. I'll read some of the questions that come up at the panel, but this is for Dr. Smith and Dr. Laborde. Everyone can kind of chime in, but and I know Dr. Laborde, you were very much involved in our community needs assessment, and Dr. Smith, you also, as you look at, and you're very active in the community, both of you are very active in the community. As you have listened to the community, as you've gone through the community needs assessments, what are some of the key themes and key areas that you heard from the community or that you saw in the community assessment that we need to address?
A really good question. I think what you said, the idea of listening is really critically important. And so having direct engagement and listening to them firsthand and using, as you said, the community needs assessment, one of the things that was really gratifying is the fact that how intelligent and how in tune the community actually is with what it needs. Because the very issues that what came up when we have direct discussions with them with the CHNA, the community needs assessment, are directly those drivers that we need to address. And high amongst them was this idea of appropriate access to quality care and continuity of care. That was kind of a universal theme. that oftentimes where the health services are located are not necessarily geographically convenient. Getting access is a problem, and continuity. And so that was really a universal theme, and it aligned very nicely with the work that Kevin is actually doing right now with our health centers. And so that's in terms of solutions. I know that Dr. Price-Haywood always likes to talk about being solution oriented. So each one of the priorities that they came up with the CHLA, and we had direct issues that came up, as I said, access in terms of continuity of care, education and health literacy was high on the list, as well as health equity and issues regarding to discrimination as well. And obviously with the structures related with the COVID isolation and stresses related to that, and I know Dr. Smith and I have talked about this, is really the mental and behavioral struggles that people are currently dealing with. And so along that perspective, I know that we've actually ensured that we provide behavioral services at our clinics, as Kevin had kind of mentioned. And I know that's one thing that Dr. Smith could probably expand upon as well a little bit.
Yeah, thank you. Just to add on to that point from Dr. Laborde, I mean, mental health and behavioral health is a major concern that comes up in community health needs assessment. And we know that it has such an impact on people's just overall well-being. And we know it's also so predominant in our adults and pediatric populations. And I think we all can feel with, living under a pandemic for 2 years, all social injustice, a war going on, there's just more and more issues. So, that's one of the issues that the Healthy State is dealing with and addressing. And there's a committee working on that. And not only working on what can we do within Ochsner, but Healthy State is about a collaboration. So how do we look at it with other community partners, really exploring what's out there and how can we help not only in clinics, but in other circumstances. So, we've talked about digital medicine. So we have a program started with the Louisiana Department of Education to provide free online therapy sessions to teachers and staff. We're looking at trauma-informed care in our schools. So just look forward to lots of different activity around behavioral and mental health because it is so key. Thanks.
Thank you, Dr. Laborde. Thank you, Dr. Smith. So I want to, as I promised, I'm going to read some questions from the chat, and it's open for the entire panel. Went back to the top to get the first questions first. So the first question is from Jennifer. She says, for our very rural areas of Louisiana, which is many parts of Louisiana, I would like to hear more about how can we achieve equity when there is such a lack of resources and quality providers in the rural areas. Who wants to take that one on?
I was going to defer to Kevin, but what I will address though, what I will address is something we talked about earlier with digital technology being at the forefront of how we're expanding access to care, but we have a very real barrier in our rural parts of the state related to high speed or lack of high speed internet and broadband services. And so we're working with the state of Louisiana, which actually has an Office of Connectivity that's addressing these issues, but understanding that in order for us to expand services in a certain area, we're going to have to diversify the way we do it, but we're not going to be able to do the things that are more scalable if we don't address some policy issues and access issues upstream of the healthcare service itself. And so a lot of work is being done in that area for broadband access, because that can really limit a lot of what you can get access to being in parts of the state that are fairly distant from the local hospital and don't have that many providers locally. But Kevin, I'll defer to you around the community health clinics.
Yeah, sure. So I wear a couple hats. One is the Community Health Center operations lead, but also within Healthy State, we've bucketed the work, if you will, into several categories. One of those categories being access related, and that's chronic conditions, preventive screening, and I'm on that committee. I actually lead it with one of our physicians and one of our other operational leaders. And we've been discussing many different possibilities of addressing health equity in rural areas. Now, I think what we'll land on are a group of potential solutions that we can bring to a broader external group, and then understand how do we partner in solving those. But many of those approaches are mobile units, which we have within Ochsner, and there are other external units that organizations that have them, which will allow for specialists as well as primary care Ochsner providers to be in those rural spaces. And we just have to figure out what frequency that would be allowed, given the number of resources that are there. It also allows for screening. To Dr. Price-Haywood's point of technology, digital medicine is an opportunity, telemedicine is an opportunity. There are many clinical concerns that can be addressed through telemedicine, routine type things that can be addressed through telemedicine. And we can bring this technology either through the mobile units or through access to just your smartphone, in which you can communicate and have those interactions with our providers. We've discussed how to bring medication, so pharmacy resources, rotating other services, and then the potential, which is the much more difficult one, but expansion of rural health centers. So how do we get those providers? But that, as we know, is much more complex because we'd have to have those providers there on a consistent, persistent basis within a rural health center. So we're being creative. We do know that this is just our lens internal to Ochsner, as in the potential solutions we'll bring to the external group. We are open to partnering, to solving this together in creative ways that may not have been there in the past, as in Ochsner provides Ochsner technology, potentially with other resources.
Yeah, Kevin, can I add something? Dr. Swaney?
Yes, please, Dr. Laborde.
Yeah, it's an excellent question, and I think the responses are critically important. But I think one of the things that we've actually been able to do with Oxyher and with the work that we've done with community engagement is actually create a thematic approach to this that will actually allow us to address some of the issues related with the rural areas. And the way that we thought about it is we want our approach to some of these issues to be what we like to describe as being person-centered, person-focused, community-centered, which means that understanding that particular area where those people are being impacted, and then applying this idea of being digitally empowering those communities, along with this concept of being inclusive, being distributive and decentralized. And when we think about it in that way, and Kevin and Dr. Eboni Price-Haywood have helped us kind of come through that, when you apply that thematic to it, it really fundamentally alters the way that we approach solving those access issues, because it brings all those points together. And when you bring them all together in that way, when we talk about distributive, Kevin mentioned the idea of the mobile units, mobile clinics that can actually bring and distribute the care to people, to their homes and to remote areas. And so bringing that together, I think, is going to be a critical strategic approach that we're going to use going forward to address some of these challenges.
Thank you, Dr. Laborde. We'll try to do a couple of more. One of them is, are there data about the utilization of the workforce development programs that we spoke about in and by Louisianians? I'll just take the first job to say the workforce development programs that we've spoken about really are Ochsner programs developed by Oxyher with community partners in some cases, and as Dr. Smith has pointed out, some that are just for the Oxyher employees. I can tell you there's 100% utilization of all the availability of those programs. I'm not aware of, I know the state has other workforce development programs. I'm not aware of the utilization rates for them. Maybe someone in the panel is aware, but I'll just also say that I know we are in conversation with the state about how we can partner together to scale the successful programs that we have at Oxyher. I don't know if the panel has any other color on that.
I guess one thing I would just add, and it may not get to the granularity of the numbers, but I think Ochsner has over 30,000 employees who are pretty much, I mean, we do have some employees in Mississippi, but that's almost 30,000 Louisiana residents. And so another program that's out there that we do hope to scale out to outside of the walls of Ochsner are career centers, where we can really provide all of our employees an opportunity to explore moving up, learning different skills, really understanding what they might need to go on to the next step, and what is it that they want to do. And that is something that I think is part of Healthy State Initiative. We'd like to be able to expand out to like local high schools, because all young people, I have 2 young people in my home, and they just need so much help and advice and guidance and, you know, good questioning to figure out what it is they want to do and what is their path.
Our time is up. Although that was a quick hour, it feels like it just flew by. I want to appreciate all the participants that joined us today. I want to do an extra thank you and a big round of applause to our panelists that took time out of their busy schedules, and our experts to help answer some questions. I hope everyone has a blessed day, and hopefully we run across each other as we go through our community listening tours. Good afternoon.